Hi everyone, welcome back. This is Module 4 and this is our Brain Core office in Greenwich, Connecticut. And the setup is really pretty simple. It is the technician or the doctor and the patient sitting at right angles to one another. And there is a treatment screen and there is a technical screen, which houses the computer and the program, everything else. So that's part of the system for sure. That's the most important part. We also have to have, obviously, headphones for people to be able to listen to whatever they're watching on the TV. And this little doodad over here is called the amplifier. And it's called a Brain Core Systems Q2 amplifier. It's what the wires get hooked up to, and it is the liaison between the computer program and the patient's brain, really, telling us what's going on in the brain while either a brain map is going on when we connect it to right here, that's where we do our brain maps, or when we do our treatment. And that's what all these wires are for. So there are right and left wires, and there are two channels. So on the amplifier, you have a channel 1 and you have a channel 2 over there. And channel 1 goes on the left side and has one ear clip. And that's these two wires over here. And channel 2 goes on the right side and has two ear clips and one sensor for the head. So the way we do every treatment is you will be attaching for channel 1 to the left ear, okay? Just one clip, and this goes on wherever the treatment protocol is for that day on the left side, and just the opposite on the right side for channel 2, you have two clips on the ear and then the cup sensor for the right side of the head. And there are different treatment areas. All the areas that you see in yellow on this particular chart are the treatment areas. Now, let's go over them briefly. This is obviously where the nose is. Maybe not so obvious, but that's where the nose is. So just for right now, I want you to ignore all the things in blue and look at everything that has a yellow circle around it, because these are all the different primary treatment areas. Now, most treatment in brain core neurofeedback using this amplifier, the way we do it, is called dual channel or double channel. Dual channel means you're going to use a cup sensor for the right and a cup sensor for the left with the ear attachments as I just told you. All right. There is also single channel work. And when you do single channel, you are using channel 1 only cup sensor on a particular single channel area on the scalp, which we will tell you where that goes. And you're still attaching for single channel the ear clips to the right ear, but you're not using the other cup sensor for the right side. You're only using channel 1 cup sensor for single channel work. So here in the office in Brain Core, we do single channel and double channel work, and you'll be trained how to set up both of those. And these are the training spots. So once again, here's the nose. And in general, the brain is divided up within our neurofeedback work into the different areas of the head as they're named anatomically. By the way, I just told you that channel 1 over here, okay, goes on the left side, and channel 2, two ear clips, goes on the right side, okay? So that's right brain and left brain. Now, the areas of the brain, we're looking down on the brain, on the top of the head right now, and this is where the nose is, and this is the skull, the back of the head. The front area is called the frontal lobe. The center area is called the coronal area, coronal, C-O-R-O-N-O-L, And the sides are called temporal, where the temples are. Okay? You also have right behind the coronal area, you have what's called the parietal. This is just about the back of the skull, but the back of the head is called the occipital. And then right above that would be the parietal, then the coronal, and obviously the frontal is the frontal area. For single channel work, there is the center frontal, which is called FZ, and then there is also the coronal center, which is called CZ, and we'll get into that a little bit later. These are the main treatment areas. We primarily do dual channel work. And in brain core neurofeedback, when you set that up, if it's F3, F4, channel 1 will have the sensor on the ear, okay, the one that we talked about, and then the F3 contact on top of the head. Channel 2 will be on the right side, 2 clips on the ear, and then the sensor, the cup sensor on F3. And I'll show you physically how to find that on top of the head as well in another module. And then dual channel for C3-4 is right here. Left side, right side. Some people will have P3-4 here and here, and some people will have O1-O2 and back here. And I will explain the different areas and what they're usually associated with symptom-wise. Also, sometimes you'll have a session that will have T3 and T4 for the dual channel sites. So, become familiar with that map. You can take a screenshot of that, while that's on. This is an important map, and we'll have this in the office as well for you to keep referring back to, because it lets you know where all the different areas are. This is the heart of the work for the technical work. You need to know where these different sites are. These are very important. Okay, so moving from here, this is what it looks like from the patient perspective, sitting in the chair comfortably, just watching TV. From the technical screen, we're getting into the program here, and when you make your notes, and there's a whole separate section about making notes, so I'll tell you how to get into the actual program. But let's go into George over here. And all of the patient's information is contained, their history, their mailbox, everything is contained here. What's going to be important for technical viewing is going to the maps area. These are the maps that I complete in order to be able to diagnose and give what's called a treatment protocol. Now, the treatment protocol is what you, as the technician, will be setting up each time. And the protocol, in George's case here, the computer gives you when you get into it. And this is computer protocol number 3. This is technical work we'll tell you about later, about what that means. It's how it's balancing the brain, what neurons are being stimulated, what neurons are being suppressed. And notice that it gives you the areas, F3, F4. So this is a very common protocol, number 3, F3, F4. The secondary protocol recommended, which I will use with George, is number 17, P3, P4. And again, this corresponds